Whether during foreplay or the main event, fingers can be one of the most powerful tools of pleasure a man possesses when used correctly. Many men underestimate what their hands are actually capable of. They reach for substitutes, gadgets, shortcuts, when the most precise, responsive, adaptable instrument they will ever have is already attached to their wrist. With the right technique, patience, and genuine attentiveness, some women can reach orgasm from fingers alone. Not occasionally. Reliably, fingers bend. They adjust pressure. They change angle. They scale from 1 to 2 to 3 with complete control. They can read texture, warmth, and feedback in real time. Nothing rigid, nothing external. Nothing manufactured can replicate that level of adaptive precision, and that is exactly why understanding how to use them properly matters, not just for her satisfaction, but for the quality of connection you build in the process. I'm Dr. Daniel Morgan, urologist and men's health expert. I've spent years working with men who want to improve not just their own performance, but their ability to genuinely connect with and satisfy their partners. Today, I'm going to give you a step-by-step, medically grounded, fully respectful breakdown of how to use your hands so the woman you're with feels safe, seen, and intensely pleasured. No shortcuts, no vague advice, just a clear, practical, structured approach grounded in anatomy and real human response. Let's begin. Hashtag before anything else, 2 non-negotiables before a single touch. 2 things must be in place. Get these wrong, and nothing else matters. Number 1. Consent. Ask clearly, not vaguely, not with a look or a hint or an assumption based on context. Ask directly, do you want me to touch you here? This is not awkward. This is not weak. In fact, a man who asks is immediately more trustworthy, more attractive, and more likely to receive an enthusiastic yes than one who doesn't. Clear communication isn't just ethically right, it's physiologically effective. When a woman feels psychologically safe, her body responds differently. Arousal deepens, lubrication increases, the pelvic floor relaxes. Safety and pleasure are not in tension with each other. They operate through the same system. Keep that communication open throughout the entire experience. Not a constant interrogation, just an ongoing awareness. Watch, listen, ask short, specific questions when needed. Her responses, verbal, physical, auditory, are real-time feedback. Your job is to use that feedback intelligently, not ignore it. Number 2, preparation. Your hands are the tools. Prepare them accordingly. Trim and file your nails completely smooth. No rough edges, no jagged corners. Wash your hands thoroughly with soap and warm water, including under the nails. Remove rings. If dryness is possible, have an unscented, water-based lubricant within arm's reach before you begin. Do not wait until you need it to find it. That interruption breaks momentum and shifts her focus. Clean hands prevent micro-scratches and reduce the risk of bacterial transfer. Lubrication prevents friction-related discomfort and micro-tearing. These are not optional courtesies. They are medical standards, and they protect her comfort and health in measurable ways. Hashtag step 1. Warm up and teasing. Most men move too fast. It is one of the most consistent errors I encounter, in clinical contexts and in the feedback men receive when they are honest enough to have those conversations. The male arousal arc tends to be rapid. Female arousal, for many women, is far more gradual, a full-body process, not a switch you flip. Attempting to rush past this reality doesn't just reduce her pleasure. It guarantees a worse outcome for both of you. Working with it intelligently guarantees a significantly better one. Start well away from the genitals. This is deliberate, not timid. Make out with her. Take your time with it. Don't rush the mouth. Move to her neck, the sides, the base, just below the ear. These areas are highly innervated and extremely responsive. Use your lips, your breath, your deliberate presence. Slow down. Move to the collarbones, the inner arms, the lower ribs. Stroke the lower back with a firm, confident hand. Cross the hips and move down to the outer thighs. As you begin approaching the inner thighs, decelerate further. Do this deliberately and without apology. The inner thighs are rich in sensory nerve endings, and they are anatomically close enough to the vulva that stimulation here already begins to recruit the same neural pathways. Stroke them slowly, upward, Stop short of the genitals. Return, repeat, over her clothing or underwear. Place your palm flat and gently over the vulva. Hold it there with calm, steady warmth. Then release. Trace slowly along the edges of the fabric. Return. The goal is not confusion. It is anticipation. Waves of pressure and release, on and off, building tension without resolution. This rhythm does something specific to her nervous system. Teasing is not filler content you rush past. It is physiologically active preparation. It drives blood flow to the clitoris, to the labia, and to the vaginal entrance. It causes engorgement of erectile tissue. Yes, women have it too. And it behaves similarly to male engorgement in terms of its effect on sensitivity. That engorgement amplifies every single sensation that follows. The man who understands teasing and commits to it is operating at a fundamentally different level than the one who skips it. Hashtag step 2. External touch first, slow and deliberate with her underwear still on. Continue outlining the outer lips and inner thighs with slow, unhurried strokes. Vary your pressure minimally at this stage. You are not escalating yet. You are sustaining and deepening the warm current of sensation you've been building. When she signals yes to skin contact, either verbally or clearly through her physical response, slide a single fingertip slowly along the outer labia, then the inner labia. Stay slow. Stay exploratory. You are not rushing toward a destination. You are mapping territory and reading the landscape. Now begin to circle gradually around the clitoral hood, the small fold of tissue that sits above and covers the clitoral glands. Do not press directly onto the glands itself at this stage. Most women find direct contact with the bare clitoral glands far too intense in the early stages of arousal. The nerve density there is extraordinary, comparable in concentration to what men experience at the most sensitive areas of the penis. You approach it with respect for that sensitivity. Indirectly, incrementally, think feather-light strokes first, then light circular motions around the hood, then slightly firmer ovals. Build each level only after she responds positively to the one before it. Simultaneously, pay close attention to her responses. Changes in breathing rate, shallower, faster, more deliberate, are clear signals. Hip movements, whether pressing toward you or subtly shifting angle, tell you a great deal about where the sensation is landing. Small sounds, changes in muscle tension in her thighs, these are your real-time indicators. And they are reliable when you are paying attention. Learn to read them alongside verbal confirmation, not instead of it. Hashtag step 3. Build rhythm around the clitoris here is a principle most men get completely wrong, and it costs them enormously. Variety is not always better. Around the clitoris especially, consistent rhythmic patterns dramatically outperform unpredictable or rapidly changing movements. When you identify something that is working, a particular direction, a speed, a level of pressure, lean into it. Extend it. Do not immediately pivot to something different because you think novelty will impress her. The nervous system builds toward climax through accumulation, not through interruption. Consistency is one of your most powerful assets at this stage, and most men abandon it too quickly. That said, there are specific patterns worth knowing and exploring before you settle on the one that works for her. Try a gentle circular sweep just outside the clitoral hood, as if tracing slowly around a small clock face in either direction. Try vertical strokes moving from the pubic mound downward toward the vaginal entrance, and then back upward. Try side-to-side figure eights centered around the hood. Each of these approaches delivers stimulation with a different rhythm and texture, and different women respond to different patterns. If she responds better to broader surface contact, bring 2 fingers together and use them as one. If she responds to more focused precision, use a single fingertip. And ask short, direct, specific prompts, softer or firmer, faster or slower, higher or lower. These are not interruptions, they are efficient calibrations. A man who asks and adjusts based on the answer is far more effective than one who guesses and persists regardless of her response. Step 4. When and how to enter wetness signals arousal. But wetness does not automatically signal readiness for penetration. These are not the same thing, and treating them as equivalent is a mistake with real physical consequences for her. Check in explicitly before proceeding. Do you want me inside? If the answer is yes, apply additional lubricant as needed, even if natural lubrication is present, and begin with a single finger. Never insert dry. There are no exceptions to this. Glide slowly into the vaginal entrance and pause just inside. Give the pelvic floor muscles time to register the presence and relax around it. This pause is not hesitation. It is precise technique. Rushing this moment creates tension that actively works against everything you are trying to build. Let her body adjust on its terms. From inside, use a slow, deliberate come here motion, angled toward the front wall, the belly side, rather than in and out thrusting. Fingers are not optimized for speed. They are optimized for angle, sustained pressure, and precision contact. Explore carefully, a few millimeters upward, downward, left, right, and read her response to each variation. If she tenses at any point, withdraw slightly. Don't abandon the process. Breathe steadily together. Return to external stimulation for a period. Let her nervous system settle. Then, when she relaxes again, slowly resume internal contact. This patience is not a concession to difficulty. It is the technique itself. Hashtag Step 5. The anterior sweet zone 1 to 2 inches inside the vaginal entrance. On the front belly side wall, the tissue often feels subtly different in texture compared to the surrounding area. Slightly spongy, slightly more ridged. This is the anterior zone, commonly referred to as the G-spot region. Clinically, it is understood as an area of dense nerve concentration associated in many anatomical models with the internal structures of the clitoral complex. Here is a critical distinction that most men miss. This area becomes far more pronounced and accessible the more aroused she is. Attempting to stimulate it before she has reached an adequate level of arousal typically produces little response, or in some cases discomfort. After proper warm-up and build-up, the same touch in the same location can produce an entirely different result. Sequence matters here more than technique. Curl your fingertip toward that front wall in a slow, deliberate come-here motion. Begin with light exploratory taps or very short strokes. Build pressure only if she explicitly invites it, verbally, or by pressing her hips firmly and deliberately into your hand. Most women who respond strongly to this area do so through steady, repeatable rhythm far more than through force or depth. Angle and consistency are the operative variables, not strength or reach. Keep your free hand active and purposeful. Use it to hold her hip with steady grounding pressure. Stroke her lower belly. If she responds well to combined stimulation, and many women respond significantly better to it, use the pad of your thumb to maintain a rhythmic pattern around the clitoral hood while your fingers work internally. Many women find this blended approach, internal and external simultaneously, more effective than either in isolation. Hashtag Step 6. Scaling up, 2 fingers and full coordination if she wants more fullness, and she will communicate this, either directly or through unmistakable physical signals. Partially withdraw your finger, rotate your hand slightly to optimize the angle, and slowly introduce 2 fingers together, both thoroughly lubricated. Maintain the curl so your fingertips sustain contact with the anterior wall. Now, coordinate both inputs with precision. Inside, your 2 fingers perform a small, controlled come-here motion or a gentle arcing movement along the front wall. Simultaneously, your thumb or free hand maintains a steady, consistent rhythm around the clitoral hood. These 2 inputs reinforce each other, and the combined effect is typically far greater than either alone. Here is an insight that separates men who are genuinely skilled from those who are simply enthusiastic. At advanced levels of arousal, smaller and more controlled movements produce more sensation, not less. Wide, fast, dramatic movements become counterproductive. As her arousal climbs, pressure and positional consistency become the dominant variables. Your job is not to escalate range of motion or introduce complexity. Your job is to hold the pattern precisely and allow accumulation to do the work. Hashtag Step 7. Holding the pattern near climax. This is where most men lose the outcome. Not through lack of effort or intention, but through unnecessary change at exactly the wrong moment. As she approaches climax, her cues intensify, and they intensify clearly. Her hips press forward or upward with more urgency. Her breathing accelerates and deepens noticeably. Her sounds become more pronounced. Her thighs may begin to tremble involuntarily. These are not signals to experiment, adjust, or introduce something new. They are signals that precisely what you are doing is working. Your only instruction at this point is to continue. The moment you identify the exact pace and pressure that her body is clearly riding, commit to it entirely. Do not adjust. Do not accelerate in an attempt to push her over faster. Do not add a new movement because you think it will help. Hold the exact pattern, at the exact pressure, at the exact speed. If she says right there, treat those two words as a precise coordinate. You have been given the location. Stay there. Anchor yourself to it completely and do not deviate. More climaxes are lost at this final stage by unnecessary change than by any other single error in the entire sequence. The discipline to maintain consistency over the impulse to do more, to trust the pattern and hold it, is the defining skill of a man who genuinely understands how this works. Hashtag Step 8. Additional techniques worth having in your toolkit hood strokes. Form a V with 2 fingers and gently slide the clitoral hood upward and downward, stimulating the clitoris through the tissue without directly exposing the glands. This delivers rhythmic sensation with a natural buffer that many women find highly effective, particularly those for whom direct contact is too intense. Outer to inner reset wave. A long, slow stroke beginning at the outer thighs, moving across the inner thighs, continuing to the labia, then tracking back outward. This temporarily broadens the field of sensation and effectively resets sensitivity, particularly useful between peaks, or when you want to let intensity drop briefly before building again. Pressure hold. Place a broad, warm, flat palm over the entire vulva and apply still, even, gentle pressure. No movement, simply warm grounding weight. This is remarkably effective between peaks or immediately after climax, when direct stimulation becomes too intense, but she still wants physical presence and continued connection. Angle shift. Slide a small pillow or folded towel under her hips to elevate the pelvis. This changes the approach angle to the anterior wall and often makes accurate, sustained fingertip contact considerably easier to maintain without the strain that leads to inconsistent pressure or premature fatigue in your hand and wrist. Hashtag Step 9. Hygiene and safety are non-negotiable. Short nails, clean hands, and proper lubrication together prevent micro tears, reduce the risk of bacterial transfer, and eliminate avoidable discomfort that has nothing to do with her anatomy and everything to do with preparation. This is not a footnote. It is the foundation on which everything else rests. If you move from any anal contact back to the vulva or vagina at any point, either change your glove or wash your hands thoroughly before continuing. Bacterial cross-contamination is a genuine clinical concern. This rule is absolute and has no exceptions. If she reports burning or pain, stop, add lubricant. Return to external stimulation and allow her body to settle fully before considering any internal contact again. If discomfort persists, stop entirely for the session. Sharp or acute pain is a clear and unambiguous stop signal. Warmth or mild stretching sensations are acceptable only when she tells you they are. Her words define the protocol. There is no interpreting around them, no overriding them, and no substituting your judgment for hers. Hashtag Step 10. Aftercare and the real debrief immediately after climax. Maintain physical contact, but progressively lighten your pressure as her body unwinds. The pelvic floor contracts significantly during orgasm and then gradually releases. This is a physiological process that takes time, and continued gentle physical presence supports rather than interrupts it. Many women appreciate being held without agenda during this phase. A hand moving slowly along the ribs or through the hair. Unhurried light massage of the thighs. Physical warmth and stillness. Offer water. Don't immediately pivot to the next thing or shift the energy into conversation before she's ready. When she is genuinely settled, not immediately after, but when she signals she is ready, ask one single question. What did you like most? Then remember the answer precisely. Do not treat it as casual conversation. This is the most specific, personally relevant piece of information she will ever give you about her own pleasure, delivered in a moment when she felt safe and satisfied enough to give you full access. It is more valuable than any general technique or principle. Treat it accordingly, and let it shape everything that follows. Hashtag a few truths most men never hear. Not every woman climaxes from internal stimulation. This is not a failure, not a deficiency, and not something that needs to be fixed. It is normal anatomy and normal variation. The majority of women require some degree of clitoral stimulation to reach orgasm. Many prefer clitorally focused external touch exclusively and find internal stimulation relatively neutral or mildly pleasant at best. Others find that a precise combination of both delivers something neither alone can match. There is no single correct answer, and the man who approaches this with genuine curiosity and openness, rather than a predetermined script he expects her to conform to, will consistently deliver better outcomes. The emotional environment matters, more than most men realize or are ever told. When she feels genuinely safe, not just physically unharmed, but emotionally respected and unhurried, arousal deepens physiologically. Blood flow increases to the relevant tissue. Natural lubrication improves measurably. The pelvic floor releases. The nervous system's capacity for pleasurable sensation expands. Patience and attentiveness are not separate from technique. They are embedded in it. They are variables with measurable biological effects that you ignore at the cost of the outcome you're trying to achieve. Your hands, used with precision, patience, and care, can be extraordinary instruments. Not because of force or dramatic range of motion, but because of their unique capacity to sense feedback, adjust in real time, apply targeted pressure, and sustain exactly what the moment requires for as long as it requires it. If you found this valuable, subscribe and share it with a man who wants real, grounded guidance rather than guesswork or exaggeration. And for men who want to support their own performance at a deeper physiological level, 2 supplements I recommend consistently in my clinical practice. Organic watermelon extract, rich in the amino acid citrulline, which supports nitric oxide production and healthy cardiovascular circulation essential to erectile function, and an advanced men's performance formula combining Arjuna, tonkarali, fenugreek, nettle root, and citrulline to support the full spectrum of male function, from erectile quality and stamina to testosterone optimization and long-term prostate health. Links are in the description and the pinned comment below.